What's the best way to teach your nonverbal child how to let someone know they're in pain?
Now that can be hard. Uh, Point to the part of the body that's hurting. The other thing you've got to rule out, if you all of a sudden have a behavior problem in an individual's nonverbal, the first thing you've got to do is rule out a hidden painful medical problem. And one of the big ones is acid reflux. He's grabbing his stomach, or, poking at some part of his body he never poked at before. Well, then maybe you better have the ear looked at. Or it might have a bad tooth. You always have got to rule that out. If there's a sudden change in behavior, where he was normally good, and now the behavior is just horrible, maybe he's got a pain he can't tell you about. So I check out some of the common ones: earache, teeth, sinus infection, acid reflux, constipation, yeast infections. Those are easy ones to rule out.
One of the things that really helped me that because my child had been speaking and then he lost language. And when he lost language, it was so devastating to me that I didn't realize it, but I had stopped language everything for him like you do for a kid that's developing typically. And so when we started therapy, they started saying to me that I should language everything that's happening. Like if he's shivering, I should say, "Oh, you're cold."
Well, then you learn the word for cold.
Exactly.
That's how you learn.
Or, if he'd be crying about something, I'd say, "Oh, you're crying, you're sad," or, "Oh, you're, right now you're frustrated," or, to just label whatever was happening. Or if he got it, I remember once he got his finger pinched in a doorway. And I said, "Oh, it hurts. Your finger."
Then you learn the word for hurt and pain.
Yes.
Because it got pinched hard enough in a doorway to hurt. So then that's where you teach the word hurt and pain.
And sometimes then he would use it in inappropriate moments, like, so that what didn't totally make sense, but that I could figure it out. So, he would point to and say, "I hurts," but then I could figure out he's got a headache.
Yeah.
That's what's happening. So I had to sleuth a little bit, but I had given him some words by languaging it. So just want to throw that out.
Yeah, that's what you've got to do. And then some nonverbals can learn to type independently, people that remain nonverbal. And some really good books are Tito Mukapadahe, How Can I Talk If My Lips Don't Move? How Can I Talk If My Lips Don't Move? He describes a sensory disordered world. Noki, the Japanese boy from Japan, he has The Reason I Jump, but the sequel to The Reason I Jump is a better book because he's older. And he describes not able to control his movements, and he's like a broken robot. If you're working with older nonverbal individuals, these books are must-reads. And
the second book
they type completely independently. Nobody's touching them.
The second book is Fall Down 7 Times.
That's right. I can never remember those numbers.
I know, me too.
He's older, and that's actually a more helpful book, I think, than the first one. And I think therapists and parents, nonverbal individuals, should read that. But it's okay to hold their wrist to get them started. But the only way you can be sure who the author is if once you get them trained, you're not touching them and you're not touching the thing they type on, whether it's a piece of cardboard or it's a keyboard. Because I've seen people take the thing they type on and then moving it around like this. Well, that's cueing.
Yeah.
No, the thing they type on has to be on a desk and not touched.
Exactly. And when you're teaching someone to do it, cueing is okay.
It's okay to cue when you're teaching. That's fine.
Yes.
That's fine.
But I think the difficulty.
Well, when I first met Tito, I'd ask him a question. He types super fast and jumps up, and then he runs around and has to flap some to calm down. He can do like 3 questions. And I asked him at a conference over a video what it was like before he had typing, and he said emptiness.
Yeah.
And so we got to, and then there's Carly's voice, and her speech therapist almost deleted the typing app off the thing. And the other thing is just try a tablet with the text messaging, put it in airplane mode so they can't send them. I was at a meeting for a big corporation, and I had dinner with a guy who signed. I don't understand sign language. So we took my phone and we just passed it back and forth with text. We didn't send them. We just passed them back and forth. And and that's how we communicated.
Yeah, I have a friend a young man who is on the spectrum, and he has maybe 10 words. And he's such a delight. Wherever he goes, he's such a delight. And you can communicate with him with the 10 words. But then I was someplace recently, and his dad said, "Have you ever read his texts?" And I said, "He texts?" And his dad showed me the texts that he will send his mom and his dad every day. And I burst into tears, Temple. There were all these things that he was texting and writing about that I had no idea that he had that much.
Well, the thing is that we need to, the typing stuff. And was he just doing that on a phone?
Yes.
Okay.
Yes.
Well, yeah, and I recommend the iPad or some kind of tablet because it's bigger, it's easier. But you see, the reason why tablets work and desktops and laptops don't work is because when you type on a phone or you type on a tablet, the print appears next to the virtual keyboard. If I pull out my keyboard here, I look down at this, you have to do this.
Yes.
And they cannot make the attention shift. And it cannot make the attention shift. Years ago, there was a teacher that took a box and put it on the desk and put the keyboard way up here so that when they typed, the print appeared right next to the keyboard.
Wow.
And that solved the problem. But they see laptops don't work very well either because you have to look up and they can't do that. They've got to see when they press the button, the letter appears and they can see it without an attention shift. And that's why a tablet usually is bigger too. And, you can find tablets around. You don't have to buy them. I have a student that she didn't have a computer. And I said, you need to adopt a computer. There's lots of computers laying around in closets waiting to be adopted. And she adopted some clunker. It works for what she needs it for. And its price was free. It's a bit clunky, but it works. And it has a CD player, which I actually wish they'd never taken those out of the computers.
Me too. But I want to say too that there are many charities out there that when you are getting rid of your smartphone because you're upgrading or you're getting rid of an iPad or
There's
another.
Tons of them. There's all kinds of electronics around, and they
take the donation.
Free. And she found a laptop within one day.
Yeah.
She had a laptop the next day. Yes, it was a heavy one, but it works.
Worked. And I want parents to know, I want everybody to know that if you, instead of throwing away those electronics, donate them. And there are charities that will refurbish those and give those to individuals on the spectrum as a way of communicating. So, and then you get a tax write-off that's more than if you threw it away, or turned it back in. So if you have a device,
but the amount of electronic stuff that's wasted.
Yeah, we don't want to do that.
And but Carly almost deleted the texting part of her keyboard thing.
Because I don't know if people watching know. Carly had shown no signs of being verbal, no receptive, no aggressive. And then when she was 13, she took the caregiver's computer and typed in the words, my teeth hurt, something like my teeth hurt, help me. And you're telling me that they almost deleted that?
They almost deleted the typing part of it. Yep, that's in the book.
Well, now she types all the time. She writes. She's an amazing advocate.
Well, and one of the things that Carly talks about is when there's any noise in the environment, huge concentration is required to keep concentrating on her typing, controlled movements.
Yeah.
And some of these people almost have like a locked-in syndrome. But then I've also seen ones where the mom's holding a piece of cardboard that's got the QWERTY keyboard on it, and she's moving it around. Well, that's killing. Can't do it.
And it's important to acknowledge that. Somebody wants to know if
you do it for some training to do that.
Yes.
You can touch them for training, but to really prove who the author is, cannot touch the person or the whatever it is they type on.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.